I'm Anna Brown from the University of North Carolina at Chapel Hill.
Hi, I just picked up my prescription.
Oh, yes. Hi, how are you doing today?
I'm all right.
Good. My name is Anna, and I'm the student pharmacist here, and I will be talking to you about your prescription today.
Okay,
Do you mind if I take a few minutes to share everything you need to know to make sure you get the full benefit and are using your medication appropriately?
sure.
Okay, first I wanted to ask you, what did your doctor tell you this medication was for?
Um, so uh, Dr. Andrews and I talked about just what it's been like happening, and everything's been happening a couple months, and it's been kind of rough.
Absolutely.
Um, um, I kind of just was going through a lot with just losing my job, and also like
Maybe
um,
some decreased mood and stress from this pandemic. It's been so hard.
yeah, definitely. It's hit others. Sorry.
That's okay. I completely, feel for you, and I know this is a hard time. I think this medication can be really, really beneficial for you. Is it okay if we talk about a little bit more stuff?
Sure, yeah.
How did your doctor tell you to take this medication?
Oh, you said how?
Yes.
Um,
How?
uh, we just like one tablet a day. Yeah.
Yes, correct. This medication, the brand name is Effexor. You may also see it written as venlafaxine, and it is for depression and anxiety, mood, and you're going to take one capsule by mouth every day. You can take it in the morning or the evening. The important thing is just to be consistent. It sometimes keeps people up if they take it, and sometimes makes people drowsy. So that will kind of depend on whether you want to take it in the morning or the evening. It's really what works best for you. And you don't want to chew it or crush it because of the way it works. Just take it whole. What did your doctor tell you to expect as far as side effects or when you would see improvement?
Um, we just talked about how it's just gonna overall just help with my depression.
Yeah.
And that he wants to like meet back with me in like about a month or so.
Exactly. Yeah, that sounds great. So, this medication, I want you to know it does not work right away. It's going to take a full weeks to get into your system to really feel that increased mood and the full benefit from the medication, sometimes up to 6 weeks. And in the meantime, you can have a few side effects, but the nice thing about this is that they tend to go away. In the beginning, you may have some sweating or some nausea and a headache, but if possible, I'd really love for you to stick through it so that we can see if they go away and you get that full benefit in your mood. Um, there's a couple other things that I wanted to tell you as well. This is kind of an odd side effect of this medication, but that capsule, you can actually see it come out in your stool, and that tends to scare people, but that's actually completely normal with this medication. So I'd like to tell that to my patients so they don't freak out. And then, of course, with any medication, there are a couple drug interactions with other prescriptions, and so it's just always important to speak to your pharmacist or your doctor before you decide to start a new medicine or change anything.
Sure.
And I have just a couple other things. As you mentioned, they want to see you back in about a month or so to see how it's going. They did provide you one refill on this medication. And after that point, you may need more refills or they may decide to adjust the dose, but that'll be up to the doctor. And a couple other things, if you miss the medication, like I said, you're going to take it once daily in the morning or the evening. If you miss it and it's not closer in time to your next dose, it's okay to take it when you remember. But if not, you can skip it and just take it as normal the next day. And as far as storing the medication, just keep it in a dry place away from others, particularly not your bathroom. Now, I know I covered a lot of things. What questions do you have for me today?
I don't have anything that I can think of right now.
Okay, great. And I know I covered a lot. Would you mind telling me how you're going to take this medication?
Once daily, we talked about taking it in the morning, just swallow it whole, and it's okay if I see it in my stool, and keep it in a dry place, not the bathroom. And there can be some side effects, and it takes a little bit for the medication to take effect.
Yeah, that's perfect. You heard everything. Well, Elias, I know that this is a really, really difficult